Well, hello to all of you Philippine Nurse listeners and followers. How are you all doing? Well, it is that time again for our podcast. And as you know, Philippine Nurse is brought to you as a public service project by the PNANV, or the Philippine Nurses Association of Nevada, in collaboration with PHLV Radio. So thank you so much for joining us today. So today we are going to talk about chronic venous insufficiency and a new available device that helps with this condition. So chronic venous insufficiency, or CVI, is a common underlying cause of persistent and uncomfortable leg symptoms, particularly swelling. It occurs when the one-way valves of the leg veins become weakened and or damaged, and it prevents them from closing properly. So as a result, the blood can flow backwards and accumulate in the veins, and it's called it's a condition called venous reflux. So the buildup increases the venous pressure, which forces the fluid out of the veins and into the surrounding tissues, leading to edema or leg swelling. And CVI can also cause pain, aching, heaviness, fatigue in the legs, and in more advanced stages, it may result in visible varicose veins or, the noticeable changes in the skin. So the direct connection between CVI and leg swelling of the legs lies in the elevated pressure and the fluid leakage, which produces characteristic discomfort and puffiness. So today we have invited Ms. Marie Hawthorn, of PCMS Advisors, LLC, and she is going to talk about, we're going to discuss CVI and a new device called VeinOPlus. So welcome,
Thank
Marie.
you. Thank you, Doris. Appreciate it.
So can you tell us a little bit about yourself? Because I know that she's a very seasoned medical rep.
Yes,
So,
I
go
have.
ahead.
I have been in the medical business for about 30 years.
30
I started in clinical laboratories and worked for LabCorp for a while, and worked for some startups with diagnostic testing, and went on to work for Johnson & Johnson in another diagnostic area that we worked with HIV patients. So I've been working with PCMS because they have an array of products that are very helpful for specific symptoms and diseases. And these are products that may not be out on the market as much as they should be. So we are trying to educate the physicians and the patients and letting them know that there is an alternative to having to go through surgery maybe right away, or be unable to get rid of the pain, and particularly, as you explained, CVI, the chronic venous insufficiency, and the edema, the swelling, the pain, the varicose veins. A lot of times, doctors may tell patients that they should walk, and that helps because the calf muscles are actually called second heart technology. Did you know that?
No, I did not. So we're going to explain all of that today.
Right.
I met Marie at an HBOAN meeting, which is the Healthcare Business Owners Association of Nevada. And I was like, oh, this is something good to talk about. And here she is. So, okay. Marie, I have several questions for you.
Sure.
What can you tell us about chronic insufficiency, and who are mostly affected by this disease?
This disease can mostly affect a lot of different people. It usually affects maybe older folks, or people who are not as active maybe as they were before. People who sit a lot at their desks all day even, or standing all day, which can also help assist in getting that. But
like nurses who stand all day.
Exactly. And it's funny because I just had a nurse be prescribed a VeinOPlus by her doctor over in Henderson, and she loves it, and she has a her legs feel very heavy, and when she's standing all day, and basically, you have to get that blood flow going.
Right.
And they call the VeinOPlus, it is a non-invasive, neuromuscular electrical stimulation that has patented second heart technology.
All right. So thank you for explaining that. I was reading in the University of Google about the device and about chronic insufficiency, and it was also, I was reading at the American Heart, and even our current president right now has chronic venous insufficiency.
He actually has edema in his ankles, where a lot of people manifest it there. And it's probably because he's not walking enough. Maybe the golf course walking isn't enough. And this is probably a device that might even help him.
Help him.
Yes.
Right.
Yes.
Okay. So a lot of older people, a lot of maybe sedentary, people, those who sit all the time, healthcare workers who stand all the time, walk all the time, don't have anything to massage their legs. So this these are the types of people that are affected with chronic venous insufficiency. Okay. So tell us about VeinOPlus.
VeinOPlus is an interesting company. This product was developed about 10 years ago or so.
Really?
And it was developed in France, and it's patented technology, and it was recently purchased by a company called Dynapulse, which is in the U.S. And they have it walked through FDA. Everything is a Class 2 device from the FDA. And so it's unusual in that there is no such other device out there right now. And folks may say, well, what is the difference between this and like a TENS unit?
Yeah, we'll talk about that, in a little bit.
But this is how it looks. And it's been around. It's covered by insurance, Medicare, all types of commercial insurances. It's got all the proper coding for it. It's ordered by prescription only.
So how does it work?
It uses pulses to contract the muscles in the calves. So it's really cool in the way they do it, because we have 2 pads here that have special adhesive on them.
Okay.
They go on each one of the calf muscles. And
I'm not going to show you my calves today.
I'm not going to stick my leg up either.
Yeah.
But it's once you get them properly and comfortably on your calves, you press this button, which is a stimulator, and you keep pressing it till you can start to feel the contractions. And what this does is, though, it's a neuromuscular type of device. It's in which it starts to contract the muscles of the calves, and it mimics walking. And
really?
So if you were told to go out and walk, and you don't want to walk because it's 112 degrees, this is probably a good substitute, because with 1 hour's use of this, it's equivalent to walking 3,600 steps, which is about 1.5 miles.
I want one of them.
And so people use it a couple times a day. You can work while you use it. I had a couple of doctors try it while they were working. They put it on their calf muscles and worked through the rest of their busy days, and they loved it. So you can imagine if it works for folks who are just walking around all day, how well it would help with people who truly cannot, have trouble walking, have pain, and that type of thing.
So that's what the stimulation is all about, right?
Right.
It mimics walking.
Right. It's contracting those muscles down in your calf muscles.
So it generates circulation.
It generates circulation, and it pushes it back up to the heart. Because if you're sitting all day and you're not moving, all that blood is kind of pooling. And I don't know whether, Darce, you've ever done exercises where they call them calf raises?
Sometimes, but I don't really go through them.
Well, this is kind of a calf raise type thing too. They say calf raises, if you're not walking, calf raises will close and open and contract your calf muscles and will get all that blood pushed back up through the heart, where it gets reoxygenated and it goes back down again. If you don't do that, you're going to end up with possible clots or just the swelling that happens down there. And it's basically because you're not pulsating the muscles enough to make it move and everything has to circulate.
Everything has to, okay. So you did say that it is applied in the calf muscle,
yes.
Right? And how long do you use it for?
Use it for about an hour. It does not hurt. It's kind of a pleasant sensation on your calf muscles. And it kind of, you can feel it. You can actually see your muscle pulsating when you put it on.
Really?
Yes. So
wow.
It's kind of fun, actually, but for people who really need it, it's very helpful. Easy to put on.
Easy to put on, yeah. It looks like you just take this and take that off and apply this on your calf.
On your calf, right.
Now, are these reusable?
Yes, they're reusable. They last probably about 4 to 6 weeks.
Okay.
But when you get a prescription for it, we send it out to you from the factory, and we send you a year's supply of them.
Oh, okay.
So if you run out of them or they start to get a little used, or you could tell that they're not working as much, you could also just put a little bit of water on the back of it.
On the back of it.
And that helps it adhere better. But usually they're good for about 4 to 6 weeks. And it's a special kind of adhesive. It does not hurt the skin either.
Yeah. So they are reusable.
Yes.
And the pad is waterproof then.
Yes.
Okay.
Yes. Water resistant. And
water resistant. Okay.
And we have a 9-volt battery in here that's very easy to change out if you need to change it out.
Okay. And can you sleep on that?
You don't have to. No, you could, but it's not recommended. So
okay,
just put this back in here. So.
All right.
Very easy.
9-volt battery.
Yeah.
Okay.
9-volt battery. They last pretty long.
How long? Approximately.
Oh my gosh, I'd say about maybe a year or so. But we always send you an extra battery too.
Okay. Okay. So how is the VeinOPlus different from other devices?
Well, there is no other device like it. I can tell you that it has a very natural frequency, a very unique, it's got a unique patented signal that pulses similar to normal muscular activation.
Okay.
Now, people may use, they might try to use those compression stockings.
Yes.
Where that just can hold things in, but it's not going to move the blood around. It's just going to be tight.
True.
And it obviously doesn't work as well as something like that. Now some people have TENS procedures that are done, but that stimulates the sensory nerves. It's mostly for pain only, whereas the VeinOPlus is a combination of the neuromuscular electronic stimulation, which does the stimulating of the muscles, but it also helps with pain.
Okay.
So it's a combination of both the NMES and TENS. Yes.
So there is clinical evidence then.
We have a lot of clinical evidence that have been done in Europe and the U.S. and looking at how this works with edema, with diabetic ulcers, some of the diabetic ulcers, with people who have varicose veins, with people with peripheral artery disease, all sorts of indications like that as well. Okay.
So VeinOPlus, like you said, is an NMES what do you call this device, which stands for neuromuscular electrical stimulation.
Right.
So what is the difference between NMES and TENS?
TENS only stimulates the sensory nerves, and it's for pain. It's pain only.
It's pain only.
Right. It doesn't do any kind of muscular stimulation. Where The TENS unit is more for the sensory nerves. The NMES includes the neuro part, nerves, along with the muscular
Nerves
part.
and muscular
Together.
Okay.
So you're doing both. You're having the brain and the nerves and the muscles all work together to contract those calf muscles. That's how it's very different from a TENS unit.
From a TENS unit, but
Yes.
they're both using a form of electrotherapy.
Somewhat, but
Okay.
you don't get the extra benefit with the neuromuscular as
see.
you do with
Okay.
with the VeinOPlus.
With the VeinOPlus.
Yes.
Okay.
Yeah.
All right.
There's no way that you can get a TENS unit that can give you the exact same results as this does, because it's patented. It's a patented technology, and that's one of the benefits that it has. That it's it just keeps getting better. We're actually in the process right now of making this wireless as well.
Oh, that'd be great.
So we won't have these wires on. We'll have the pads. You just put the pads on the back of your calves and just turn on the device, and it starts contracting your calf muscles.
Wow, that's awesome. Are there any contraindications for using this device?
That's a great question. There are contraindications, but specifically for people who have any kind of defibrillators or pacemakers. That's about it.
So you can't use them?
You can't use it if you have those. Now, if it's under the care of a doctor or they want to make a different decision, that's fine. But the manufacturer suggests that if you have a pacemaker, not to use it.
Okay, so those are the only visible, the two mandated
restrictions.
Restrictions,
Right,
you know,
exactly.
for the device.
Right.
So you can use this for pregnant women?
Yes. As a matter of fact, a lot of pregnant women go through periods of time, especially as they go along in the third trimester, where they get very swollen.
Yeah.
And this works for them. We actually have a study on that as well with pregnant women, and using this device to help them with their to get the blood flowing from their lower calves up to their heart and then back again, which is very important, because especially if they're not walking, or if they're in pain, or if they're just not feeling well enough to do a lot of walking and their own body isn't doing it sufficiently, this is a great treatment to help with getting that done.
So, like this one is saying, these are some of the symptoms of chronic venous insufficiency. And if you got tired or achy legs, if you have burning or tingling or pins and needles in the legs, which I do that, cramping in your legs at night, okay?
Yep.
Or discolored skin that is about reddish brown in color.
Yes, we have patients like that too.
You have patients like that. Edema, and also flaking or itching of skin on your legs and feet. So if you have these symptoms, you do have chronic venous insufficiency, right? But that has to be verified also by your physician,
Right.
correct?
Exactly. Yes.
Yeah,
Yes.
correct. Okay. So let's see. Again, the battery life you said takes a few weeks.
The battery life, I'd say 9-volt batteries are pretty good. They stick around for a while.
So do you do it like twice a day?
Oh, for this particular, to do this, sometimes it depends on what the doctor says, but a lot of times they recommend doing it twice a day, or you could do it 3 times a day. I don't think there's a whole lot here that can hurt you in terms of too much use.
It doesn't cause skin irritation or
Not that we know of.
Not that you know. How about applying it on fragile skin?
Fragile skin, that's probably something that you should be very careful about, especially skin that might be flaking or something along those lines.
Close to a wound, maybe?
Yes.
Yeah?
Yeah. If there are some patients who do have diabetic wounds and are being treated by wound doctors, if you have it somewhere close by that it helps the stimulation and the contractions of the muscles to get blood stimulated in that area. That's good too, but that would be something that a nurse or physician would make a decision on.
Yeah.
But it really helps get oxygen to that area of the body.
Yeah, I know that a lot of like older people or people with steroids, they have like this onion skin, as we call it.
Oh yes, yes, yeah.
Those can
Peels.
be considered that peels, and a little bit of bump can cause redness or flaking. So you wouldn't probably recommend it.
I would probably use some common sense there and not want to put something like that on it. So.
But the bottom line is, it needs a prescription.
Right. We
from
have
a physician
a very
before
easy,
you can use this. Right?
Yes, we have specific VeinOPlus prescriptions. So everything is indicated for the doctor or the provider to mark off. The only thing that you do have to do is make sure that the muscle and the nerve are connected, that the muscle has not been cut off.
Oh, okay.
Okay, so if you had one of the legs amputated or something like that, you would use it on the other leg. But
okay, so it does have like a little checklist for the physicians. It says disuse of muscular atrophy.
Right, that is that's the coding for it.
That's the coding
diagnosis
for it.
code,
Okay.
and it covers a large array of issues, and that's where they ended up putting, suggesting that that's the proper coding for it.
Yeah, it does say in here that the nerve supply has to be intact.
Right.
Okay. All right.
Good.
Well, this is good. So, okay. So, what about insurance coverage?
Insurance, Medicare covers it. Most commercial insurance, commercial insurances cover it, like the Blue Cross and Blue Shield. And now you also have to check with your state. But one of the benefits with that VeinOPlus team does is they actually do all the prior authorizations for the clinician's office. So all the clinician has to do is sign off and sign on the chart, the patient's chart, send a copy of the front page of the patient's chart along with the prescription, and then we take care of the prior authorization, we take care of ordering it, and we take care of the shipping directly to the patient's house. And then our team follows up with each patient personally to make sure that they got it, and we either make a home visit with them to show them, or we show them over the phone, or we show them on on like a Zoom call or something.
Okay.
But we're very, very interested in ensuring patient compliance and make sure they use it properly, because it'll help them.
I'm glad that you have a follow-up with this. And so what are the outcomes that you have seen in the follow-ups?
A lot of folks who have used it have found that it's much easier to walk. Their pain has minimized compared to what it was before. Their swelling has gone down. They feel a lot less pain maybe than they did in the past. And a lot of the clinical studies that we have will actually go through and show those benefits that happen after so many days of using this. And a lot of times you use it for 6 months, maybe twice a day. Now insurance will cover it for a year, for 12 months. So at that time, patients may go back to their physician and see what the progress has been with fixing their issues.
So if the insurance won't cover it, what's the alternative?
Well, we do have, if necessary, we can set up like a payment plan of some kind, and see what we can do for that. And we want everyone to be able to have access to something like this that will help them.
Absolutely.
So we try to work with as many different commercial insurers as we can. So as we're getting new insurers out there, we try to add them onto our list.
Okay. So you work here in the Valley. Which of the physicians, what types of medical providers do you
work with?
Work with VeinOPlus?
I work with a lot of podiatrists, And as a matter of fact, the Podiatry Center of Las Vegas, Dr. Torgerson, his group, he's got 2 areas. He's orders it a lot. We also work with Nevada Heart and Pulmonary Heart and Lung, that group. Dr. Kala is one of the ordering physicians there. We're reaching out to wound care physicians as well, and we're looking at some OBGYNs that may have patients who are, like we mentioned, that are going through pregnancy and are having issues with swelling and edema, that type of thing. All sorts of doctors. Primary care doctors would be a good opportunity because they see patients before they have to send them off to a specialist.
Right.
And this could help mitigate some of the symptoms that the patient might be having if they have it ordered by their primary care first, and then if they're referred to an endocrinologist for diabetics or for vascular issues.
Right.
This might get the patient on a head start to recovery.
Okay, so mainly the primary care providers who work with some vascular insufficiency patients, right?
And of course, vascular doctors as well.
Yes. Okay, all right. Well, that's good. Yeah. I didn't know this has been in existence for like 10 years, so that's good.
Well, it started out more on the East Coast, and it kind of has been working its way over. So it's a matter of getting the word out there. And, so many things have happened in the last 10 years, and COVID having an issue. And in the Valley here, there's been a lot of consolidation of practices to these other larger companies. So getting access to physicians and getting good information to them is difficult, and this is such a great opportunity to do that.
That's good. So who makes VeinOPlus?
It's a company called DynaPulse.
DynaPulse.
Yes.
Okay.
And they are out of the Midwest. I think it'll say that.
Yeah.
And it originally, DynaPulse is, it was originally made in Europe, but it was brought over here when it first started in the old days, 10 years ago. But now it's being made in the USA. Everything comes from the United States, and everything is assembled and put together in the U.S. And then our shipping is all from the U.S. So everything comes from there, and it gets to the patient within a couple 3 days or so.
3 days. Okay, great. What is your message to the people there, or the community, or to the healthcare workers who may have some kind of encounter with chronic venous insufficiency?
I would recommend that you know that this product is available, and that if you're going through any kind of issues like edema or trouble walking, pain when you're walking, any kind of venous wounds, achy or tired legs, the tingling and the pins and needles in the legs, cramping at night, that type of thing, varicose veins, especially the edema, because this is so difficult. And patients whose doctors have said, just get out and walk more, especially folks that might have walkers or it's hard to walk. There's no downside to doing this. If anything, it's going to help you recover faster and feel better. And everyone has an opportunity to feel better.
Yeah. Oh, wow.
And the more folks that use it, you won't see as many patients maybe having to have a lot of wound surgery if you can catch it in time and get an opportunity to do this.
Yeah. Because circulation is really important.
It's very important.
Very important.
I don't know how many, I took a lot of anatomy classes, but I don't remember realizing that the calf muscles do push about 80% of your blood up. Yes.
Right.
And if you don't move those, a lot of times there's more clotting, and patients who are diabetic can sometimes have thicker blood for some reason.
True.
And
Okay.
it's harder to pump that blood up. And if you're sitting and you're not moving, then you could end up with diabetic wounds and
Diabetic
issues
wounds.
like that.
Right,
Yeah.
right.
So while you're watching football, for you guys out there, this is a great time to put it on and just do your cheering that way. If you are playing golf, you can do it that way. And as a matter of fact, our nurse patient, she's using it to walk, to do her job with too.
Well, see, I work remotely now at home, and so walking for me during the day is a little difficult.
This would be great for you.
It'll probably be great for me.
Yes. Well,
So that's good. That's
Yes.
good to know.
yes,
Good to know.
it is.
So,
And it's so easy to get. That's the thing. It's not a hard product to have prescribed to you.
okay.
You can
Very
ask your doctor for it.
good. Okay. Good. Anything else you need to add?
No, I think I'm good.
You think you're good?
I think that if anyone has questions, that they can reach
Yes.
out to.
You can, if you have any questions about it, you can reach Marie.
You can reach me, right?
At
You can either call
Where's
me
that at?
or email. I guess calling is easier. Or
is it calling is easier or whatever you want?
whatever? You can either email me at Marie MARIE at PCMS Advisors, all one word, .com.
Okay.
Or you can text me at 949-866-0082.
Okay. There you go.
Great.
Marie, she's great. She responds right away. So
Right,
if you
I
have any of those, just we could probably put that on the on screen.
Okay.
But just let Marie know, and I think this will benefit all of you. But however, we do recommend that you seek the advice or a prescription from your physician.
Right.
You can't. They're not going to give it to you anyway without prescription, right?
No, I have some patients who have actually, I've emailed them a prescription and they've brought it in with them to their doctor.
Oh, okay.
And I also have, if physicians want to try it out, they're more than able to try it out as well. So
Very good. Very good. Okay, so there you go, folks. Miss Marie Hawthorn, thank you so much for
you're
coming
welcome.
to our
Thank you for
program
asking
today.
me.
Of course,
Thank you, guys.
And this is good information to all of you who suffer from CVI or chronic vascular insufficiency. So thank you again.
Oh, you're welcome. Thank you
Okay.
so much.
All right. And to wrap up our today's episode, chronic venous insufficiency affecting an estimated 25 million adults in the U.S. is more than just a discomfort. It is a widespread condition with serious health and economic implications. So here are a few key things that you should know. With the prevalence, CVI impacts about 1 in 20 adults, or roughly 5% of the U.S. adult population. With regards to the age factor, the risk increases with age, especially for those people who are over the age of 50. And with regards to gender differences, women are more commonly affected than men. So, according to the internet, Google University, as they say, mortality in 2022, CVI was listed as the cause of death for some 62 individuals and mentioned in 977 death records. So, as for the healthcare cost, annual care cost of CVI exceeds about $3 billion nationwide. And so for the treatment seeking people, despite its prevalence, only 1.9 million people seek treatment every year for CVI, leaving about 23 million untreated. But the good news, effective treatments are supportive, and supportive devices are available. So if you or someone you know is experiencing these symptoms of CVI, do not wait. talk to your healthcare provider and explore the options that you could make a real, that could make a real difference for you. Right, Marie?
Definitely.
Good. So thank you so much for tuning in today. Take care of those legs. Please be safe and be well. And until next time, this is Doris Bauer, your Philippine Nurse host, signing off for now.
Just like a friend from back home.
This is your Filipino radio experience in Las Vegas. PHLV Radio.